Hello everyone, I'm Dr. De La Paz here at Olean Dental Studio, and today we're gonna be talking about Gummy Smile. There are a lot of questions that we get from patients, and I wanna be able to have the opportunity to respond to some of those today. If you do have any more questions after today's video, you can call our office and have a consultation and we can talk more about it with you. Let's get started. Alright, the first question that I'm going to be addressing is what's a gummy smile and what causes it? So very simple. A gummy smile is no more than when you smile, you're showing a little bit of too much of your gum. And honestly, what causes it, it's based on your anatomy when you were developing and how much your jaw grew, how much of your teeth are showing. There is nothing really for certain that we can tell about what causes it. All we know is it depends on how your muscles and your jaw bones developed. At what point does the smile consider too gummy? Well, to answer that, it's mostly based on how you look at yourself, because if you're showing about 3 to 4 millimeters of gum when you smile, that is considered as gummy smile. But if you feel comfortable with that, then it's all good. So you might be wondering, should I be concerned? Is this gonna affect my dental health, or is this just an appearance thing? And the answer is, you're right, it's just your appearance. Most of the time, gummy smile is not really related to any problems with your gums. It's not related to any dental issues. It's just how you were formed, and it's more related to your appearance. So let's talk a little bit about what are the most common treatment options to treat this gummy smile. So I know about two treatments. One that is more temporary type of treatment, it's Botox. So we normally inject a couple of units of Botox to relax the muscles on the upper lip. That way when you're smiling, your lip is not going up as much. And in return, you don't show as much gum. That option is temporary because with Botox, it goes away in about 3 to 4 months. So you would have to get it done again and again if you really want to use that type of treatment. Now, if you want something more permanent, then you require surgery. You would probably require reshaping of your gums, or maybe reshaping of your gums and the bone underneath it. It just depends. It's a case-by-case scenario depending on how bad it is and what results you want to achieve. So either we do Botox or we do surgery. Okay, so another question that I wanted to address that I do get a lot from patients is, are there any risks associated with this type of treatments? And the answer is, not generally, but it could, because let's say you're doing Botox, even though it's temporary, if a side of a muscle relaxes more than the other side, your lip can get a little bit weird looking, but that's something temporary that can be most of the time fixed with no issues. Now, with the surgical aspect, if you're someone that is already having other type of conditions in your body that could predispose you to bleeding or soreness, maybe that's something that you would struggle with. But most of the time on healthy patients, any of the two treatments work just fine. And even if you get surgery, the discomfort is minor following the surgery. So you might be wondering, well, I'm young now, but what if I age? Would my gummy smile get even worse? And the answer is no. It actually, the opposite happens. As we age, our lips come down a little bit farther. So I tend to see patients where when they were young, they would have a very showing gummy smile, and then as they get older, that decreases. But it's not always the case. You have to kind of monitor it. But generally speaking, no, it shouldn't get worse as you age. All right, so the last question I'm going to address is, how do I help as a provider my patients to decide which option is best for them? For me, it's crucial education. So when I sit down with my patients and they have that concern, I make sure that I address every single aspect of their concerns and that I explain and educate it to the best of my abilities so they can have information from both sides, either the temporary solution with the Botox or the permanent with the surgical aspect of whatever is needed. And then they can decide what they think will fit best with what they're looking for, and I will help them whichever route they will decide to go with. Alright guys, so I feel like today's video is pretty comprehensive, responding the most common questions about gummy smile. But if you feel like I didn't answer that question that you have in your mind, feel free to call our office at 941-629-3200, and we'll be very glad to help you and answer all of those questions for you. Bye-bye.